Resuming debate, veuillez please débat. The honourable member for Halifax.
Thank you, Mr. Speaker. I'm very pleased to rise today and speak to this bill. I'm very pleased that this bill is in the House. I am. And like I said in my questions to the member for Oakville, that took a lot of courage. I don't think my speech will be quite as courageous, but I really wish, yes, the words that the member for Oakville said are exactly the words that I think that I wish I had said in this place. I think that this bill is long overdue, and I'm glad it's here. You know, I'm not going to criticize the delay because it's here. I do think it needs to go a bit further, but it's a great first step. When I was the health critic a few years ago, the pharmaceutical industry, I knew nothing about it. And just being a critic, people started giving me books and articles, and I started talking to experts. I went around Canada and talked to all kinds of folks working on this issue, and wow, you start peeling back the layers of the onion and you realize what a messy, dark world that is. Pharmaceutical companies, it's really quite amazing. The power that they have, the control that they have, and the trust that we give them. We just hand over our lives in this way and say, well, I guess they know what's best. And one example that I would use often when I was talking to people was the Therapeutics Initiative in British Columbia. So the Therapeutics Initiative in BC is an arm's length body. It's not government. There are experts on that panel, and they make decisions about recommendations about what drugs would be covered under British Columbia's pharmacare program. And you may think, well, why would you have to do that? Can't you just look on the label? Can't you just find out if a drug is worth covering or not? Well, because we're not always told the truth, Mr. Speaker, and drug companies will go to great lengths to ensure that their drugs are on those pharmacare lists because they have a lot of money to make from it. Sometimes they'll take a drug and they'll change one molecule and say it's a new breakthrough drug when it's just one molecule different from the old drug that works. Maybe they're not making enough money off of it. And that one molecule change can actually do a lot when it comes to impacting people's health. And I'm just reminded by seeing some conversation up there at the chair that I need to seek unanimous consent to split my time, and I hope that the chamber would allow me that.
Does the honourable member have unanimous consent to share her time with a colleague? Agreed? Agreed. The honourable member for Halifax.
Thank you, Mr. Speaker. My whip is settling down now. I would like to share my time with the member for Alfred Palan. So when it came to Vioxx, Vioxx was touted as this incredible breakthrough in pain relief. And why do we need a breakthrough in pain relief? We've got ibuprofen, we've got acetaminophen. Well, some of those drugs actually do a bit of wear and tear at our stomachs and can cause internal bleeding. And some people have died, even from something as simple as ibuprofen. So the big breakthrough drug, Vioxx, goes under many other names, but that's probably the most common name. And it was touted as being a pain reliever that wouldn't cause these bleed-outs to happen. And it was approved by Health Canada. And so, of course, you're going to put a lot of faith in that approval, right? Well, the thing was there were no published clinical trial reports about this drug. And we actually couldn't see if it didn't cause bleed-outs or if it was a better pain reliever, and yet Health Canada approved it. Therapeutics Initiative, when they actually did an analysis of this new drug, they said, no, we're not recommending this to be covered by BC's pharmacare. The clinical data isn't published. We're a bit suspicious about what's going on here, and they said no. And then it began. The lobbying began, heavy-duty lobbying to government to get it on the pharmacare list because a lot of money's at stake here. Got to get it on this pharmacare list. And you've heard of grassroots organizations that come from the grassroots that are in our communities and they work together. Well, there's a term in dealing with pharmaceutical industries, AstroTurf groups. AstroTurf groups aren't grassroots. They seem like they're grassroots, but they're actually funded by the drug companies. So we have these organizations, these AstroTurf organizations, funded by drug companies, but just regular folks, right? And a lot of them probably even really believed what they were being told. And they would say, you know, I have a constituent calling me, and this is just an example, saying, Megan, I'm just one of your constituents. Can we talk about this drug that isn't covered? And I don't know that they're actually, you know, getting the the funding to do this from a pharmaceutical company. So these groups pop up, and it's hard. We know, we're politicians. It is hard to say no to constituents. So all of this pressure to get Vioxx on the list, all of this pressure. And wouldn't you know, the Therapeutics Initiative, well, they did the right thing, because eventually Vioxx had to be pulled off the market because it was killing people. It wasn't any better than ibuprofen or acetaminophen for your headaches, and while it may not necessarily have caused internal bleeding, it caused heart attacks. Now, I don't know about you, Mr. Speaker, but if I have the choice of living with a migraine for a few days or having a heart attack, I'm going to live with the migraine. And many people have come forward and said that because of Therapeutics Initiative, hundreds of lives were saved in British Columbia. Hundreds of lives. And I think that we deserve that kind of safety standards for all Canadians, not just British Columbia, because at the very least, our federal government is there to protect us, to make sure that we're safe, to make sure that we aren't being sold a drug that is actually going to do more harm than good. The member for Oakville at the beginning, or partway through his speech, he said that he saw today as the beginning of the end for drug companies and their hold that they have on us. And I hope he's right. I am standing here with my hands clasped, and I hope he's right, because they are so big and they make so much money. The global pharmaceutical industry is one of the, if not the, most profitable industry in the world. They're worth about $300 billion US a year, and that's expected to rise to $400 billion in the next 3 years. Only 10 drug companies cover a third of the market. Just 10 little companies. 6 are in the US and 4 are in Europe. And it's predicted that North America and South America, Europe and Japan will continue to account for a full 85% of the global pharmaceuticals market well into the 21st century. And the World Health Organization has spoken out about this, and they have said there is such a pressure to maintain sales that now there is, and these are their words, quote, an inherent conflict of interest between the legitimate business goals of manufacturers and the social, medical, and economic needs of providers and the public to select and use drugs in the most rational way. So there's this tension between sales and our lives and our health, our safety. And I think this is particularly true, and same with the World Health Organization, when you think about where are we getting information about these drugs? Well, we're getting that information from the companies. They're telling us which drugs are most effective. And doctors, we rely on them. They're busy folks, right? They're courted by pharmaceutical companies. They're given these long, pages and pages of information that is, everything's embedded, and then there's like a little quick piece that says, try Vioxx. It's great for headaches. And we don't get the proper information because it's coming from the companies themselves. So I think that this bill is a good step in the right direction because there are some key things in here, like it will allow the minister to recall drugs, to order a recall on drugs. And I think that's a really important thing that we need to see. It allows the minister to order a manufacturer or an importer to modify the label of a drug to update when it comes to side effects or health risks associated with it. It will allow the minister to order a review of a drug and require that a copy actually be given to them. Wow, I'm out of time. Okay. So it's doing some good things here. It needs to go further, Mr. Speaker. You heard my question to the member for Oakville about publishing clinical trial data. That is incredibly important. I guess I'll sum up by saying, if there's one thing that the federal government is here for, it is to protect us and keep us safe. And we need federal government to fulfill that role. So I'm encouraged to hear that the minister is open to some amendments. I would also be encouraged to hear if the minister was open to more legislation, because this is incredible. And if we are going to see this as the first step in tackling the pharmaceutical industry, then there logically has to be a next step. and I do look forward to that next step as well. Thank you, Mr. Speaker.